Hi, I'm Eli, and today I'll be giving a quick topic lecture on the Medicare for All topic. The resolution is resolved the U.S. federal government should enact the Medicare for All Act of 2019. Before we get into anything, let's first go over some important vocabulary that you'll probably come across in your debates or while researching. A beneficiary is the consumer or the person who is buying health insurance and receiving health care, so individual people like you or me. Insurance is just an agreement between that beneficiary and an insurance company that in exchange for monthly premiums, this insurance company will cover some or all of that person's healthcare costs. So then, of course, a premium is just a fee that the person pays in order to stay covered. Many plans have something called a deductible, which is a set amount of money that the beneficiary must pay before the insurance company begins to cover any costs. For example, if your insurance plan has a $1,000 deductible, you have to pay out of your own pocket the first $1,000 of any healthcare costs. But after you pay that $1,000, the insurance company will start to cover the costs. Everything else being equal, a lower deductible is better because you don't have to pay as much out of your own pocket to get your coverage to kick in, which will save you a bit of money. A copay is a set payment that you make every time you visit the doctor. For example, you might have a $20 copay every time you visit your physician. Insurance companies use copays as a checkback to prevent people from abusing the system and receiving a ton of unnecessary care. Finally, Medicare is just the federal health insurance program in the United States that covers the elderly and disabled. You can think of it like Social Security, but for healthcare. Now let's talk more about the Medicare for All Act of 2019, and there are actually two separate bills by the same name, one in the Senate and one in the House. They're extremely similar, and for most arguments, it won't really matter which one you're referencing. Both bills promise to provide health coverage for all U.S. residents, replace private insurance, have lifetime enrollment, and have provisions to negotiate drug prices and promise no premiums. However, there are some differences between the two bills that could be relevant depending on which arguments you decide to run. The first main difference is the time frame. Jayapal's proposal has a much faster transition. In just 2 years, everyone should be using the Medicare for All system compared to a 4-year transition in Sanders' bill. This could be important if you choose to run a case involving coronavirus. The second key difference is about drug price negotiations. While both bills have provisions that allow the government to negotiate drug prices, the Jayapal bill allows the government to use something called compulsory licensing, which lets the government give drug patents to other entities besides the company that owns the patent in order to manufacture and provide drugs at a certain price. The third difference is that the House bill calls for the elimination of value-based programs. Value-based programs are incentive payments that made to healthcare providers if they give high-quality care. These programs can be good, and there's evidence that suggests they could be bad. For example, under the Affordable Care Act, the government had a value-based program where they penalized hospitals with readmission rates higher than the national average by withholding their funds. The argument could be made that these practices encourage hospitals to be more thorough and to provide higher quality care. However, there is research that suggests in response to these practices, hospitals lowered the readmission rates by just not allowing sick patients to return at all, which would have caused unnecessary deaths. So if you're interested in running this argument, you should definitely do more research. There's a lot of evidence out there. Finally, the last difference is the authorization of hospital budgets. In the House bill, hospitals would have annual budgets set by the government as opposed to being paid on a per patient or per procedure basis. Having a budget would significantly decrease overhead costs because hospitals would no longer have to keep track of every procedure or every single pill given out, and they would get to be reimbursed by a single payer, the government, rather than hundreds of separate entities, which requires a lot of administrative costs. So in terms of picking arguments, using the Jayapal bill would be better if you want to run an argument about decreasing these admin costs. Now let's talk about the current healthcare system. Right now, over 90% of Americans are insured. The majority get it from their employer, a third from the government through Medicare or Medicaid, and the remainder either buy insurance individually, and then about the remaining 10% are uninsured. However, these statistics that I just mentioned are pre-coronavirus, and because of the pandemic, millions of people have lost their jobs and their insurance with it. An important thing to note, though, is that just because someone is insured does not mean that they can afford care. 85 million Americans are underinsured, meaning that the high deductibles or high copays still prevent them from affording their health care despite having insurance. So yeah, the current system in the United States is not too good. Americans pay twice as much as other developed countries, but our life expectancy is lower. Deductibles are increasing faster than wages, which means out-of-pocket costs will only increase, and overall healthcare spending is going to take up a larger and larger share of household income as in the future. So clearly there are some changes to be made to our healthcare system. We're going to cover some ways that Medicare can help in the next section, which are the pro arguments. So while I'm going to discuss pro arguments, I'll only talk about a couple that I think are less obvious or need some extra explanation, but at the end I'll include a big list of all the arguments I could think of while making this video. It is by no means a comprehensive list, but hopefully it can give you some ideas and help you start prepping. The first argument is discrimination. The argument here is that the current healthcare system, whether it be Medicare, Medicaid, or just insurance in general, severely underserves certain groups such as African Americans, poor people, or LGBT people. Medicare for All would hopefully reduce this by giving insurance to everybody at an affordable level. The impact would then be helping these underserved populations. This argument is usually best read along with framing, either about prioritizing solving racism or some kind of structural violence framing. The next argument is drug innovation, which is basically the value-based pricing argument from the pharmaceutical topic. There are provisions in Medicare for All that would allow the government to negotiate the price of these drugs, and there's evidence that suggests these price negotiations would prioritize higher impact drugs and allow those drugs to be sold for more money. That in turn would incentivize drug makers to create new and innovative drugs instead of repeating the same drug over and over again with very minor adjustments. Okay, so this is the big list that I was talking about. Most of these are pretty obvious, and this is just what I thought off the top of my head while making these slides. We already went over the first two, but you could also make arguments about lowering drug prices via the negotiations, increasing jobs or wages because now employers don't have to pay for private insurance, increasing access to healthcare, and decreasing the overall cost that people spend on healthcare. In this slide, I have some more squirrely arguments that might be worth researching. The first is about pandemic response. You could make the argument that with a unified healthcare system, like universal healthcare, data collection would become more centralized and the government can make better and more informed decisions for future outbreaks and the current one. Universal healthcare would also allow more people to get access to testing and treatment. The next argument is about the opioid crisis. With Medicare for All, more people would be able to get treatment for addiction, and with drug price negotiations, naloxone, which is used to treat opioid overdose in emergencies, would probably be more accessible to hospitals and to first responders. Finally, it might be worth it to research about rural hospitals, specifically about the budgets of these hospitals. There's evidence to suggest that many rural hospitals are struggling and not making enough money. And since the Jayapal bill would allow the government to pay hospitals a set budget, that would save them a lot of overhead costs for these hospitals, up to 25% of their budget, of all the money that they spend, and maybe allow them to stay open and keep treating patients. Next, I want to go over some strategies that might be useful for the pro side. The strategies are to, number one, use coronavirus as an impact magnifier, and number two, to look at the trends of the status quo. So right now, because of the pandemic, we're seeing it's revealing a lot of flaws with the current healthcare system. For example, many people are being tied to, many people have their insurance tied to their job, but now because of coronavirus, millions have no job and thus no insurance. The amount of uninsured people getting insurance from Medicare for All would definitely be higher right now than under any other circumstances or under normal circumstances. Also, maybe think about how the current pandemic might progress if we maintain the current system versus if we implemented Medicare for All. There are definitely arguments to be made about access to testing and treatment. Finally, maybe consider how healthcare insurance is quickly getting more and more expensive. Even if Medicare for All is not 100% necessary right now, 5 or 10 years down the line, when healthcare takes up an even larger part of household income, things could be different, and it might be better to just implement the program now. Okay, next up is cons. So just like before, I'm going to go over a couple of arguments that I think are interesting, and then show you a big list of arguments at the end. First is doctor shortage. This argument is that under Medicare for All, doctors might be paid less, and that would A, cause doctors to quit, and B, discourage young people from entering the field in the first place. And once these doctors quit, or when less doctors start entering the field, there's less access to care and more strain on existing doctors. Another version of this argument would be straining the healthcare system in general, because with Medicare for All, more people would get insurance and thus more people would visit their doctors and visit hospitals. Even if no one is quitting, there would still be a significant increase in the demand for healthcare, which might strain the system, leading to either delays and or lower quality care. Next up is an economic shock. So both versions of the Medicare for All bill say that private insurance will not be able to compete with government insurance. That would get rid of a huge chunk of the private insurance industry because now they can only offer a very small and limited range of services. When those companies lose a huge part of their business, there will likely be a ton of bad things happening, like stocks crashing, layoffs, and bankruptcies. And because the health insurance makes up a very big part of the economy, these negative effects could easily cause a recession or worse. Okay, here's the big list of the arguments. We talked about the first two already. Raising taxes and deficit spending are just arguments about how the government would pay for Medicare for all. Raising taxes could be bad because people would have to pay more money, and it's possible that the increase in taxes on individuals would be greater than savings, so on net, people might be losing money. Deficit spending could also be bad because as the US debt increases, it would crowd out private investment, possibly slowing the economy. Finally, there are common arguments from the pharma topic. So if drug price negotiations cause pharma companies to lose revenues, that could affect their ability to innovate new drugs and donate drugs to countries that don't have access. And also the process of negotiations could possibly lead to drug delays or drug shortages. Okay, so some other arguments to consider are number one, budget cuts. If the government decides to cut spending in other areas to pay for Medicare for all, that could be bad. It could be cut in social services, foreign aid, etc. Second one is the election. So Medicare for all as a policy seems to be popular among left-leaning voters who weren't going to vote for Trump normally. So if it were to be enacted, some people might view that as an accomplishment of the Trump administration and vote for Trump in the upcoming election. And if Trump wins, I'm guessing you can probably think of a lot of negative impacts to him winning the election, like his handling of the pandemic, for one. Now let's go over some strategies that might be useful for the con. First is the scope of harms. Many of the pro arguments focus on benefits to a certain and limited portion of the population. For example, the argument about access to care mainly regards the 10% of Americans who are currently uninsured. However, most of the harms outlined by con arguments affect the entire country and everyone in the country. For example, if doctors quit, that's not just harming uninsured people, that's also going to affect previously insured people and just everyone in general. Same thing with an economic shock or a drug shortage. The next strategy is considering harms to other countries. This is mainly referring to arguments about drug prices. If prices in the US go down, what will happen to prices or access to drugs in other countries? There is lots of evidence that suggests the high profit margins that drug companies make in the US allow them to sell at lesser profit margins in other countries and even donate drugs to other countries. But beyond arguments about drug prices, an economic shock, increased US debt, and Trump winning the election, these arguments, all of them will have an effect on the international community and foreign countries. Okay, that wraps up this quick topic lecture. In the description of this video, I will link a document containing evidence for some of the more obscure things that I mentioned in this video. Hopefully everyone learned something new, and good luck to all that are debating this topic.